The Enlightenment, a period of intellectual and cultural growth in the 18th century, marked a significant shift in how society approached the treatment and understanding of mental illness. This era saw the rise of more scientific and humanitarian approaches, with influential figures such as Philippe Pinel and William Tuke advocating for the humane treatment of the mentally ill. These advancements laid the groundwork for the birth of modern psychology, the Enlightenment Context. The Enlightenment, also known as the Age of Reason, was characterized by the emphasis on reason, science, and the rights of individuals. Thinkers of this period challenged traditional views and sought to apply rational thought to all aspects of life, including the treatment of mental illness. The move away from supernatural explanations towards a more empirical understanding of human behavior was a key feature of this era. Philippe Pinel and the moral treatment movement. Philippe Pinel, a French physician, is often considered a pioneer in the humane treatment of the mentally ill. In 1793, Pinel was appointed as the chief physician at the Bicêtre Hospital in Paris. Shocked by the inhumane conditions in which patients were kept, he famously removed the chains from patients and advocated for a more compassionate approach to care. Pinel's moral treatment emphasized kindness, respect, and the use of reason rather than punishment and confinement. His work was instrumental in shifting the perception of mental illness from a demonic possession to a medical condition that required treatment and understanding. William Tuke and the York Retreat. In England, William Tuke, a Quaker and philanthropist, founded the York Retreat in 17. The retreat was established as a response to the brutal conditions in asylums of the time. Inspired by Quaker principles of compassion and dignity, Tuke created an environment where patients could receive moral treatment in a peaceful and supportive setting. The York Retreat became a model for humane care, and its success influenced the reform of mental health care practices across Europe and the United States. The impact on modern psychology. The work of Pinel and Tuke laid the foundation for modern psychology by promoting the idea that mental illness could be treated through humane and scientific methods. Their approaches emphasized observation, documentation, and the development of therapeutic relationships, which are now core components of psychological practice. The moral treatment movement also highlighted the importance of creating supportive environments for patients, an idea that continues to influence contemporary mental health care. The Enlightenment era marked a turning point in the treatment and understanding of mental illness. Figures like Philippe Pinel and William Tuke played crucial roles in advocating for humane and scientific approaches, challenging the prevailing notions of their time. Their contributions set the stage for the development of modern psychology, transforming mental health care and improving the lives of countless individuals.